New developments from the Philippines, where government figures now say that more than 10 million people have been affected by Typhoon Haiyan. The super typhoon left massive scenes of devastation after making landfall earlier this month. More than 5,500 people were killed and more than 1,700 people are still missing. Now, Médecins Sans Frontières says that even though humanitarian aid is increasing, there are still villages and towns that have not yet received any aid. Now, CNN, of course, covered the typhoon and its aftermath extensively, and we are going to continue to follow this story as the recovery efforts continue. And joining us now to talk more about the aid operations is Martin Broughton. He's a spokesman for MSF, and he joins us here in the studio. Martin, thanks for coming in.
Morning.
I'm curious to find out that even weeks now after the storm first came ashore, MSF, is still getting to places where no relief, no supplies have got into yet.
Yes, it's because of the geography. I mean, you're talking about 10 million people, but they're spread out over hundreds and thousands of small islands. So, for example, our people in the island, the bigger island of Panay, have been going out to the smaller islands, and there are, say, 20 of those near the coastline, relatively near, and they're finding people who've lost their boats. It's the only way for them to get to the larger island.
And how many people are on these smaller islands?
Well, it might only be, we think there's about 20,000 families there, but they've lost all of their livelihood. They've lost the means of getting food, which is their boats for fishing. They've lost the way of getting to the mainland, which is to get help.
And they obviously have no medical supplies, or would be running out at least. What sort of conditions are these people who have yet to receive help, what sort of conditions are they living in?
Well, the most extreme, on the islands, for example, where waves just went over them. I mean, they're low-lying, so everything was smashed. They're really left with hardly anything, so it's difficult for them to get clean water even. So some of those conditions have been really tough for them. Lots of local people have been helping. They've been going out to them. But where we're adding value, I suppose, is where you just have to have those medical supplies to be able to cure infections, where you've just got to have antibiotics, where you've just got to be able to help people with difficult labour and deliveries for children.
What are the critical areas now? Is that the critical areas? It's operations, it's of that nature, it's not disease so much?
There are certainly no epidemics, and we've been very pleased that hasn't happened. It might have done, but it hasn't. So yes, I mean, actually what we're getting back to is not so much the direct impact of the typhoon, where people got injured and broken bones and cuts and things. It's everything else that everybody needs in their...
It's the normal day-to-day medical conditions that people face.
I was talking about, you know, deliveries for people who need help with their pregnancies, but it's also chronic diseases, so people who've just lost their medication for heart conditions, for diabetes, for epilepsy, everything like that.
But are we talking about many people, perhaps thousands of people, who now are in life-threatening circumstances because they don't have access to medical supplies, medical expertise?
Well, many. So, for example, the clinics that used to exist, and actually the Philippines had a pretty good operating rural health system, but a lot of that has been smashed down. So in that island that I was talking about, one of the towns where we're working, there used to be 8 clinics run by the Ministry of Health. Now there's only one of those that's at all left standing, so we're having to supplement quite a lot there as they get themselves back together. And it means that anybody who did need emergency care hasn't been able to get it until we've been able to provide that.
And just very quickly, the international aid effort so far, and indeed the Philippine government aid effort, obviously this is an enormous, unprecedented scale, but how do you think the aid effort is going so far? Is enough, is what you would expect to be enough coming in?
Well, we're learning all the time about the difficulties of operating in every new environment. So every disaster is different, and because this one is so spread out, the geography makes it extremely hard. So we were slow, everybody was slow in really getting to grips with it, but I don't think that we're saying it's anybody's fault, except just the way the islands were designed. So it's been terribly tough, but now it is coming together.